Welcome to the Endo Kids podcast, the podcast where we help families navigate the ups and downs and in-betweens of growing up healthy. I'm Dr. Rinku Mehra, the founder of Endo Kids Concierge and a pediatric endocrinologist, and my co-host is Dr. Lindsey Waldman, who is also a board-certified pediatric endocrinologist. We are here to break down the science of hormones, share real stories, and answer the questions parents wonder about the most. So whether you're worried about growth, puberty, thyroid, or just want to understand your child's development a little bit better, you're in the right place. We believe every family deserves answers, support, and a caring partner in their health journey. So grab a cup of coffee, get comfortable, and let's tackle this topic together today. This podcast is for educational purposes only and is not a substitute for medical advice. Please consult your child's healthcare provider for individualized care.
Hello and welcome back to the Endo Kids podcast. My name is Dr. Lindsey Waldman. I am a pediatric endocrinologist, and today I am lucky enough to be joined by a registered dietitian nutritionist. This is Shelby Santin, and I'm going to let her introduce herself, tell us a little bit about how she got started in the nutrition world, and she's going to talk to us about what she does today. Shelby, thank you so much for joining us.
Yeah. Thank you, Dr. Roll. Thank you so much for having me. And yes, I'm a dietitian and I specialize in eating disorders. So that's my specialty area. I got started in nutrition, honestly, because I just love food. And I'm from an Italian background. So food was like very much the center of my whole life, every family function, all the things. So it just made sense for me to get into a field all about food. And then as I went along, I became really interested in eating disorders because that mental health and food overlap just really interested me in helping people develop a healthier relationship with food where food can be a positive, like how I grew up with it being such a big part of my life. I think how I landed on this field.
Absolutely. And I had mentioned in some of our previous podcasts, my background is in nutrition as well. I'm also a registered dietitian. I love talking about food, and the way that I got started similar is that I was just always interested in food. I describe reading the back of the cereal box, eating breakfast, looking at the nutrition facts and wanting to know more. So I think that's how a lot of us got started there.
Yeah.
A little bit about exactly what you do in your role working with patients with eating disorders.
Yeah, for sure. So I work with both adolescents and adults for those who may be struggling with an eating disorder or just struggling with their relationship with food in any way. So I'm really working on some of the things you think of when you think of a dietitian. I'm working on providing recommendations for how many meals and snacks per day, portion sizes, how to develop balanced plate, all those things, education. I feel like that's a little bit less part of my role. Like maybe that's 10% of our sessions or what I'm working with. And then in reality, I'm spending a lot more time working with people on exploring their thoughts around food, different food rules they might have, fears that are interfering with being able to eat adequately, and really working through those barriers to get to a point where someone's stable in their nutrition, medically stable, or just in general being able to have a relationship with food that doesn't get in their way of their lives. Yeah.
What are some misconceptions that you often see when you're dealing with nutrition and eating disorders in adolescents?
Yeah, I think this is a really good question because I feel like just in general, eating disorders tend to be really misunderstood. There seems to be a lot of just misunderstanding of what that really means. I think in our media and society, eating disorders, when you think of an eating disorder, everyone thinks of a very narrow group of people or what that might look like, either in terms of behavior or body size. So I think the biggest misconception is who can be impacted by an eating disorder. And really, it could be anyone, regardless of race, gender, body size, socioeconomic status, all the things, age, and less than 6% of those with eating disorders actually diagnosed are not di- underweight by BMI criteria. So just those misconceptions, I think, are most common and sometimes impact people's ability to get identified in treatment early.
And let's start at the very beginning. Like a patient is referred to you, and what are the first steps, the things that you focus on and talk about?
Yeah, that's a great question. I think first step is definitely getting a really thorough history. Usually my first session is just gathering history, what's going on, what started, when did the food challenges start, what's going on, all the things, and then figuring out, okay, what's going on nutritionally, or is this person eating enough? Probably is the first step. Is there any medical complications? So referring them to the pediatrician or their medical provider to get a good thorough history of labs, vitals, all the things. And that's always first priority is to work towards nutrition adequacy. And then from there, and then we'll dive more into that, what's making it hard to achieve that and come up with a plan.
And when you're initially seeing that patient and assessing them, and again, you're working with a team, the medical team, which might include a pediatrician, mental health provider, et cetera, how do you distinguish between an eating disorder and maybe more, quote, picky eating or selective eating habits that we all see in our own families, our patients, our friends, et cetera?
Yeah, that's a great question. I think it can be really sometimes tricky to tease apart, but like one of the things for picky eating I might look at is if, has this person always been picky their whole lives and maybe they're slowly expanding or at least not narrowing further their food preferences would be probably the first thing I'd think about of, okay, is this just people have different food preferences? Some people are pickier, some kids struggle with picky eating, and that isn't necessarily an eating disorder, of course. When I'd be more like some yellow flags for it being more than that would be, of course, if there's a body image perspective going on or any avoiding of foods for like fear of adverse effects, whether that be weight gain or the calories or what's in the content of the food to the point where they're really avoiding it completely and aren't able to even have it on special occasions or all the things. So I think that would be to me a bigger yellow or red flag if there's something more than just the eating going on. And of course, there could be picky eating and an eating disorder going on as well. But I think those are the things I would be asking about or figuring out to sift through it.
And when we, as parents, caregivers, medical providers, think about talking about weight, this is a big thing, right? It is a big thing in our own families when we're talking to our families, our friends, again, in the medical community when we're talking to patients. It is very difficult, but also important, I believe, to talk about weight and health. What are some ways? And I know everyone is different and every family is different, every friendship is different, but what are some of your recommendations on how one can talk about weight in a way that might not cause, I hate to say it, but cause an eating disorder in our children, in our patients? How do we work with that?
Yeah, I think this is really challenging. And it's so true. I think so many kids have had an experience where they go to the doctor as a kid and they're told their weight's too high, and that can lead to some avoidance of food and then an eating disorder. So I always say I, with especially young kids and adolescents, I always recommend doctors not talking to the kid with the kid present, like only talking with the parents if there's any concerns going on. I do practice from a weight inclusive standpoint, but in my own nutrition counseling, I'm never really focusing on numbers, but instead of working on what might be going on nutritionally that we might need to address or what other health promoting behaviors are important, all those things. So I try to separate the number versus, okay, that number might be telling us something that we have to address in terms of health, but it's not, I don't ever want to send a message to a child that their weight is wrong or, they did something wrong. Because I think the younger the child, I think they just connect that to, okay, I'm not in a of accepted body maybe, and I need to now do something with my weight in order to be accepted or loved or all the things. I think that can be a recipe for some, not for all, of developing that unhealthy relationship with food and their bodies.
Absolutely. And that's
Yeah.
really hard. I always, in practice, talk about health, right? Being healthy, that's what's important. Putting nutritious foods in our bodies make us healthy. Moving our bodies make us healthy and trying to find the balance there. think that a lot of the families that we work with there's two different spectrums. So there's one spectrum where the kid is just never hungry or super selective / picky in what they're eating, and the family's worried about them not taking in enough calories. And then there's the other spectrum where there's a lot of unhealthy food behaviors, maybe not a lot of movement. And so it's hard. And sometimes both exist in the same family. And that can be really hard for families as well. Are there any other recommendations you have for families and for parents when talking about food in a way that, again, they don't want to give that much judgment or lay that much judgment on their children?
Yeah, no, that's a great question. It can be so tricky to navigate, especially within the same families. I think nutrition's nuanced. And I think younger kids see nutrition a little bit more black and white, just developmentally. So I always recommend taking a really neutral approach when talking about food. So not labeling foods as good or bad, clean, junk, trying to think of all the anything with moral value. Sometimes even in my work with clients, I'm working with those with eating disorders. I sometimes even shy away from healthy or unhealthy, even though that's so normal. And this conversation is so normalized in our culture. Like, of course, parents are like, I want them to eat these foods and less of these foods and all the things. But I think when we're labeling those foods, the kid can pick up on, okay, if I eat this food, my parents might be upset with me, or this means I'm did something wrong or I'm bad. Sometimes that can lead to like sneaking of those foods or hiding them and or feeling out of control around them either because they're off limit. So I think overall, my number one thing for all parents is just being as neutral as possible with the language. And then as parents, it's their kind of responsibility to be providing regular meals, regular snacks, making sure there's all of the food groups represented, but we don't necessarily need to have a whole lot of discussion around that. Like, I think it's more showing kids, like, okay, this is what our family norms are. We're eating together. We have everything represented on the plate versus restricting anything. If that makes sense.
Absolutely. Those are some great ideas as well. And when you are working with patients, again, we talked about your intake with them, what you look for. Tell us a little bit more about your work going forward. What is it that you focus on, and how do patients get to a stable endpoint?
Yeah, I think and I think with each situation is totally different. I think if I'm seeing an adolescent for the first time who's been diagnosed with the eating disorder and we're working together, I think the first step is working with the families to set up where parents are taking on some of the responsibilities in terms of food choices and what's put on the plate and expectations for completion. So a lot of times it's working with families at first to develop, a nutrition plan that's going to get the child enough nutrition. I think that's always the first step because when someone's malnourished or not getting enough food, brain's not functioning properly. So a lot of times it's a physiological response to be thinking about food more, to constantly be consumed with those thoughts. So the first step is always working on nutrition adequacy and having clients be eating regularly and getting parents involved in that process. And then from there, a lot of challenges might come up where maybe certain foods are tricky or going out with friends, like away from parents. I think then from there, like the adolescent can gain more and more independence around food. And that might be what we're working on. The last phase is just maintenance, being able to tolerate life's ups and downs and working on different food things as they're getting older and being able to integrate recovery to be more long lasting because obviously challenges are going to come up as the child ages and different food challenges like with going away to college or whatever it may be.
And again, I'm sure every patient is very different, but how long does it typically take for patients to normalize with adequate nutrition? This might be a terrible question.
It's a good question. I always struggle to answer it because I think everyone is so different. And I think it depends a lot on how ingrained the behaviors are when someone first seeks treatment. I think with an adolescent, I love working with adolescents because that is usually the age of onset for eating disorders. And some people don't get any intervention maybe until they're in their 20s or 30s. So I think working with an adolescent is great in that sense because typically it's being caught early for the most part. But I would say it's hard to even come up with an average, but I would say at least 6 months to a year. I've worked with families for years. Of course, my work might be less and less frequent at that point, or we will be working on many different things, like more independence, or toward the end of treatment, maybe a kid figuring out how to go to sleepaway camp or something and manage food or things like that. It will be a little bit different than in the beginning, where it's like a more intensive work with the family, with parents involved, in getting someone to like a stable place in terms of nutrition, medically, etc.
Absolutely. And that totally makes sense. I know in my own patients where I've had patients who have struggled with eating disorders, lost weight, and then gained weight back, it takes a very long time for all of those hormones, if they had hormone issues,
Yeah.
to get back to the normal place. An adolescent girl who was getting regular periods and then stopped because of the weight loss, regain the weight. It takes a very long time, longer than anyone even thinks, to get those normal periods back, even when that weight is restored.
Definitely, and that's so true. Yeah, I think it takes everybody, I think, a different amount of time too. Like, I definitely have patients who get their period back as soon as they start eating well again. Others, it can take a year, 2 years. Maybe they need other medical intervention, all the things.
Absolutely. And so, what is like a key message you want families to remember about nutrition and eating disorders?
Yeah, that's a good question. I think it's definitely for families. I think the number one thing is early intervention and treatment is the best prognosis for eating disorders. So I think it's keeping an eye on things. If you're noticing sudden changes with your child's eating habits or body image concerns, talking about it with your trusted health professionals as soon as possible, with your pediatrician, or seeking out even assessment from a dietitian or therapist or whatever it may be. And another thing is, I think there's this idea that somehow parents cause eating disorders. I think that's in our media and different things, and that's absolutely not the case. The development of eating disorders is so complex, and parents never cause eating disorders. And if anything, they're really important in terms of identifying them, biggest support in terms of getting better too for their children.
I think those are really important points. Like you said, early intervention. So, you don't necessarily have to see that significant weight loss to see in your kid that something has changed. So it doesn't necessarily need to be the number on the scale, but if you're noticing those changes in the food habits, any of those concerns, talking to, like you said, a trusted medical professional like your child's pediatrician to look into it to that. So I definitely echo that. And as a parent myself, it is very nice to hear that we don't put the blame on parents. There's so much that goes into it, just like you said, and remembering that the family is the most important thing in recovery.
Absolutely. Yeah.
Very important. And if parents are concerned or just want to learn more, maybe they're not at that point yet, but maybe they want to learn more. Are there any resources that you recommend to families?
Yeah, so I do like the book. It's called How to Raise an Intuitive Eater. I really like that resource for families. It's more general, just talking about some of the things like not labeling foods good or bad, or just how to set a child up to have a healthy relationship with food. And then if someone is struggling with an eating disorder or concerned, I like the book How to Nourish Your Child Through an Eating Disorder. That's a really helpful resource for families who may be needing treatment or just learning what the process looks like, I think, overall.
Amazing. Those are great. I'm definitely going to write both of those down for myself. And if families want to get in touch with you, they want to ask you questions, perhaps set up appointments to talk with you more about what you do, how can they reach you?
Yeah, so they can reach me by email or phone. On my website, I actually offer a free 15-minute discovery call. So if they're curious about whether we'd be a good fit but aren't quite sure, or there's something going on nutritionally with their family that they want to discuss, that's a good first step, just to see if we're a good fit. If I feel like we're not a good fit and they might need another resource, I always refer out to other professionals who might be better suited for whatever their needs are.
Perfect. And just remind everyone of your website.
Yes, my website is shelbysantinnutrition.com, and my last name is spelled Santin.
Perfect. Perfect. And saw that you see patients virtually in Virginia, DC, and Maryland. Is that correct?
Yes, and West Virginia.
And West Virginia. Perfect.
Mhm.
Perfect.
And then in
Um,
person in Falls Church, Virginia.
Perfect. Thank you so much for joining us on the Endo Kid podcast. If you have questions for myself or for Shelby, please visit us at endokidsconcierge.com and we will join you for the next podcast. Thanks again, Shelby.
Thank you for having me.
Thank you so much for joining us on the Endo Kids podcast. We hope you're leaving with a little more knowledge and a lot more confidence. If you have questions, stories, or topics you'd love us to cover, please send them our way. We love hearing from you. And don't forget to check out our website, www.endokidsconcierge.com, for free resources, guides, and more ways to connect. You're not alone on this journey. We're here to support you and your family every step of the way. If you enjoyed this episode, don't forget to subscribe to our podcast so you never miss an update.